Americans are often taught to imagine two different people: the taxpayer who gets up and go to work, and the welfare recipient who lives off that taxpayer's money. Worker versus welfare recipient. But millions of Americans are both. A new government report found that millions of adults receiving Medicare and food assistance earned wages during the year. Many worked full-time hours, and thousands work for some of the largest corporations in America. Medicaid and SNAP are keeping these workers fed and insured. They may also be helping sustain an economy in which employment does not consistently cover basic necessities. Now, both can be true, but here's what the evidence shows. In 2026, the Government Accountability Office released an updated report examining working adults enrolled in Medicaid and are living in household receiving SNAP. The GAO is Congress's independent auditing and investigation agency. SNAP, the Supplemental Nutrition Assistance Program, is what most people still call food stamps. Medicaid provide public health coverage to eligible low-income adults, children, pregnant women, people with disabilities, and others. Using census and data from 2024, the GAO identified approximately 13.8 million workers aged Medicaid recipients who earn wages, and 10.6 million working adults living in households receiving SNAP. Some people may appear in both groups, so those numbers should not be added together. Approximately 2/3 of the working Medicaid recipients work at least 35 hours a week during the periods when they were employed. Among working SNAP recipients, it was roughly 70%. However, fewer maintained that schedule throughout the year, and 48% of working Medicaid recipients and 51% of working SNAP recipients work at least 35 hours a week or 50 to 52 weeks. Now, that is substantially lower than among workers outside the programs. The report therefore described more than lower hourly wages. It also captures interrupted employment, reduced hours, seasonal work, and unpredictable schedules. Someone can work full-time when hours are available and still experience period when the paycheck stops working. Approximately 88% of working adults in both programs were employed in private sectors. They were concentrated in transportation and material moving, food preparation and service, retail sales, office and administrative support, and healthcare support. These workers moved packages, prepared meals, stocked shelves, cleaned buildings, and cared for patients. The report found especially high percentage of food service occupants, jobs that frequently combine modest wages with inconsistent hours and limited benefits. The GAO also collected employee information from agencies in 11 states. Those states are not the entire country, so the employee figures cannot be treated as national totals, but the available data reveal a notable pattern. 46 companies ranked among the top 25 employers of Medicaid enrollees or SNAP recipients in at least 2 states. 17 were among the 50 largest Fortune 500 employers. The tables repeatedly included companies such as Walmart, Amazon, McDonald's, Dollar General, Dollar Tree, Kroger, Home Depot, FedEx, and Tyson Food. App-based delivery and rideshare work also appeared prominent. In Georgia, Walmart employed an estimated 4,600 non-disabled, non-elderly adult Medicaid recipients. In Oklahoma, the estimate was 4,700. Amazon employees estimated 2,700 adult Medicaid recipients. In Tennessee, approximately 3,500 adult SNAP recipients work for Walmart and 3,100 work for Amazon. These figures do not reveal every worker's wages, hours, or household circumstances. They do establish that substantial numbers of people working for major private employees qualify for public assistance. SNAP and Medicaid exist because food and Medicare are necessities, and employment doesn't always provide enough income or affordable insurance to attain them. These programs prevent hardships. At the same time, much of the service economy operates through low wages, part-time staffing, franchising, contracting, variable scheduling, and app-based work. Those arrangements provide businesses with flexibility. They also shift financial risk towards employees. When demand falls, workers lose hours. When schedules change, their income becomes unpredictable. When affordable workplace insurance is unavailable, workers must obtain coverage elsewhere. Public assistance then fills part of the gap between what employment provides and what a household actually needs. The assistance protects the worker from hunger or medical insecurities. It also allows employment arrangement to continue without the employer covering the entire cost of sustaining its workforce. From a progressive perspective, this resembles an indirect corporate subsidy. The company receives the employee's labor. Medicaid and SNAP covers needs the paycheck does not consistently meet. The public funds the program. Lower labor costs can then benefit the corporations and its investors. Large employers possess considerable control over wages, scheduling, and benefits. An individual cashier or warehouse worker has far less negotiating power, especially when refusing a job could mean having no income. That imbalance supports the argument that taxpayers are helping sustain low-wage business models, but the employer list does not settle the argument by themselves. Large corporations appear frequently because they employ enormous workforces. A company can employ thousands of benefit recipients while those workers represent a relatively small share of its total employees. Raw numbers cannot tell us whether one business treats its workforce. Eligibility also depends on more than one paycheck. Household size, family income, hours, medical circumstances, and periods of unemployment can all affect whether someone qualifies. A worker may receive a respectable hourly wage but lose hours during part of the year. Higher wages also create trade-offs. A company might accept lower profits. It also may raise prices, reduce hiring, close locations, automate positions, or demand greater productivity. The result depends on the employer, the industry, location, the size of the increase. Finally, Medicaid and SNAP were created to assist eligible households. Using them does not always establish that the worker or that worker's employer have done anything improper. These points weaken the claim that every benefit dollar represents corporate abuse. They do not erase the economic condition documented by the reports. Millions of wage earners require public assistance to meet basic needs. Workers can change jobs, organize, negotiate, and vote, but those choices are constrained by available jobs, family obligations, and the ability to survive without income. Employers directly control wages, schedules, and workplace benefits. Large corporations can also lobby lawmakers, redesign jobs, relocate operations, and invest in automation. Congress controls federal funding and major eligibility requirements. States administers the program and determine many coverage rules. Consumers contribute pressure for low prices, fast delivery, and long operating hours. Responsibility is therefore spread across the economy. Power is not. The employee stocking shelves overnight does not possess the influence of the corporation setting wages, the investor demanding returns, or the lawmaker establishing the rules. Raising the minimum wage could increase earning for workers below the new threshold. Its effects would vary by region and industry, and businesses could respond through some combination of price, profits, staffing, and automation. Stronger unions would give workers more direct influence over wages, scheduling, and benefits, requiring large employers to contribute towards public benefit costs could recover money, but it can also encourage companies to avoid applicants that they believe will most likely qualify. Separating healthcare from employment would prevent job loss from automatically threatening medical coverage, although it would not solve inadequate wages. Fair scheduling laws could require advance notice, minimum hours, or compensation for canceled shifts. Strengthening the safety net would protect families without necessarily changing the employment practices that made assistance necessary. Each policy places more responsibility on a different institution: employers, government, or the workforce itself. The evidence established that millions of Medicare and SNAP recipients earn wages. Many work full-time hours during at least part of the year, although that they were less likely than other workers to maintain stable year-round employment. They were concentrated in lower wage occupations, overwhelmingly employed in the private sector. In the 11 states examined, major corporations employ thousands of recipients. The report does not calculate the public costs attributed to each company's wage policies. It cannot tell us how many employees would leave the program after receiving a raise, and it cannot predict precisely how employers would respond to higher labor costs. Those limits matter, so do the findings. The scandal is not that working people receive assistance. Someone who prepares our food, delivers our packages, stocks our stores, or cares for patients should not go hungry or lose medical treatment. Medicaid and SNAP protects families when their income does not cover those needs. But that protection also reduces pressure on the employers to confront the full cost of the labor they use. If public assistance is necessary to keep companies' workforce fed and insured, then the price appearing at the cash register is incomplete. Taxpayers cover part of it. Workers cover part through financial insecurity, delayed treatment, and unstable lives. Their families absorb the rest. The familiar divide between taxpayers and welfare recipients hide that reality. Millions of Americans occupy both categories. They work, they pay taxes, and they receive assistance because employment does not necessarily provide economic stability. The safety net is catching those workers. And by doing so, it is also catching the employers who depend on it. Investigate honestly, explain clearly, challenge power, let the evidence earn the opinion. This is Punching Up.